Hello everyone. Today we are going to discuss about febrile convulsions. First we will see what is febrile convulsion. Febrile convulsions is a seizure occurring in a child who is between 3 months to 6 years. And it's always associated with fever and usually occurs within 24 hours of onset of fever. And it's not caused by CNS infection. You always have to exclude meningitis and encephalitis. And without a previous history of afebrile seizures. Then we can divide febrile convulsions into two categories: simple or typical, complex or atypical. Simple ones would be having these features. It would be a generalized seizure and last less than 10 minutes, and it would be single seizure, and there won't be any transient neurological phenomenon. When we compare the simple seizure with the complex seizures would be focal and lasting for more than 10 minutes, and there will be 2 or more seizures in same febrile illness while there is transient neurological phenomena. So the febrile convulsions recurrence rate is 30% higher if it's an atypical febrile convulsion and there's a positive family history of focal convulsion or epilepsy, and the first fit at young age such as like less than 12 months, and if there's a risk of epilepsy like 2 to 4%, and it would be higher if the convulsion is atypical or there's a family history of focal convulsion or epilepsy. So how do you manage the febrile convulsion? You have to attend vital function, which is ABC, airway, breathing and circulation. Check whether the airway is patent, check whether the saturation is enough, and check the blood pressure and pulse rate. And patient should be positioned in left lateral, and you should suck out secretions, and you should give facial oxygen and control convulsion. How do you control the convulsions? You can give rectal diazepam 0.5 mg per kilogram, or you can give IV diazepam, which is 0.25 mg per kilogram. Then you should reduce body temperature. Either you can give antipyretics and also tepid sponge you can do. You always have to rule out CNS infection. Less than 18 months low threshold for lumbar puncture. So you should avoid lumbar puncture if it is like less than 18 months, and if their signs of meningitis are not reliable, like there must be not having neck stiffness, chronic signs of Buddhist sign, and if lumbar puncture is not carried out, you have to do careful neurological observation over first 24 hours without antibiotics. And when a patient is having febrile convulsion, their parents must be panicking. So you have to give proper education and counseling to the patients, tell about the nature and prognosis of the disease, and tell this is a common illness and there's a good prognosis, and you have the instruction on management of fever and the management of convulsions. And you always have to tell them that oral diazepam prophylaxis is not recommended now, and the rectal diazepam given to mother if the seizure is prolonged.